Hey there, it's Dr. Charles Modlin. I'm back with you again for another Health Equity Brief. Again, these Health Equity Briefs are an opportunity for me, Dr. Charles Modlin, urologist, kidney transplant surgeon, health equity leader, to share information with you that I believe is important for you individually, your family and community to maintain and improve your health. So the Health Equity Brief today is I'm going to focus on health equity with respect to cancer in African American women, talk about the disparities with respect to breast cancer, ovarian cancer, uterine cancer, cervical cancer, and colorectal cancer. So health outcomes and disparities in cancer among Black women versus white women and other races and ethnicities. So cancer disparities among women of different races and ethnicities are a significant public health concern. Black women in particular experience a different incidence rate in terms of incidence and outcomes and treatment recommendations for various cancers compared to white women and women from other racial and ethnic backgrounds. So in this brief, I'm going to examine the disparities in the incidence breast cancer, colorectal cancer, cervical cancer, and uterine cancer, and ovarian cancer, and focus on the incidence, outcomes, diagnosis, and treatment recommendations. So, what's the incidence and outcome of breast cancer in Black women? Black women, although they have a lower incidence of breast cancer overall compared to white women, Black women are more likely to be diagnosed at younger ages and with more aggressive forms of breast cancer, such as triple-negative breast cancer. The 5-year survival rate for Black women is approximately 78% compared to 91% for white women, reflecting a remarkable disparity in outcome. So the diagnosis and treatment, delays in diagnosis and treatment may arise due to factors such as limited access to healthcare, socioeconomic barriers, and implicit biases in the healthcare system. We've discussed that before in other health equity briefs. Treatment recommendations for Black women may include a combination of surgery, chemotherapy, and targeted therapies, but access to these treatments can vary significantly. That access to not only healthcare but specific treatments for breast cancer contribute to the lower overall survival rates in Black women versus white women. So let's go on to colorectal cancer. African American women have the highest incidence rates of colorectal cancer compared to women, with a rate of approximately 44.7 cases per 100,000 women, compared to only 37.6 cases per 100,000 white women. Colorectal cancer mortality rates are also higher in Black women, with a 5-year survival rate of about 60% in Black women compared to 67% in white women. Late-stage diagnosis is more common in Black women due to lower screening rates and access to preventative care. Treatment options do vary, but typically include surgery, chemotherapy, and radiation therapy, but disparities, again, in access to these treatments persist. What about cervical cancer? The incidence of cervical cancer and outcomes in Black women. Black women are more likely to be diagnosed with cervical cancer than white women, with the incident rates of 9.6 per 100,000 compared to 6.6 per 100,000 in white women. Higher rates of cervical cancer in Black women. Diagnosis and treatment, regular pap smears and HPV, that's for the human papilloma virus vaccinations, are critical for prevention. But again, access to these preventative measures is often limited for Black women. Treatment typically involves surgery, radiation, chemotherapy, but access to these treatments often can impact outcomes. Uterine cancer, the incidence and outcomes of uterine cancer in Black women. Uterine cancer has a higher incidence among Black women who are diagnosed at a rate of 29.6 per 100,000 compared to 22.9 in white women. Black women tend to be diagnosed at later stages for uterine cancer, leading to worse outcomes. The 5-year survival, which in black women is about 63% compared to 82% in white women. Diagnosis and treatment options include hysterectomy, that's complete removal of the uterus, radiation, hormonal therapy, but again, access to comprehensive care can be hampered by socioeconomic factors. Ovarian cancer. The incidence of ovarian cancer is slightly lower in black women, 11.4 per 100,000 compared to 12.5 per 100,000. But again, black women often present with more advanced disease, contributing to the 5-year survival rate in black women to be about 36% compared to 48% in white women. Early diagnosis is often challenging, and many black women are diagnosed, again, as I said, in later stages, which contributes to poorer outcomes. Treatment typically involves surgery, chemotherapy, but disparities, again, in access, it's a repetitive thing. Disparities in access to effective care can impact survival rates. So, conclusion, health disparities in cancer outcomes among black women compared to white women and other racial and ethnic groups highlight the need for targeted public health interventions. Factors such as access to care, socioeconomic status, implicit biases in healthcare, and late-stage diagnosis contribute to these disparities across these various cancers that I've spoken of. We need to increase access to screening, culturally competent care, community outreach, and research initiatives. Continued research into the unique factors contributing to cancer disparities among black women can inform targeted interventions. Community outreach, public health campaigns should educate black women about the importance of early detection and treatment options for various cancers. Culturally competent care involves training healthcare providers in cultural competency, which can enhance communication, trust between healthcare providers and the community, the patient, black women, leading to improved care and improved outcomes for black women. And again, increasing access to screenings. Efforts should include focusing on improving access to routine preventative health screenings and preventative measures, particularly in underserved communities. So please like, share, subscribe, spread the word about these disparities in cancer in black women. I'll see you on the next Health Equity Brief. And again, thank you for joining me. You can find me on YouTube, X, Twitter, Facebook, and LinkedIn. Thank you. I'll see you until next time. Dr. Charles Modlin.